States are seeing a drop in Omicron cases, but they remain high here in Alabama.
A lot of people still have questions. How much is this affecting our lives and how much does it need to? So what do we need to know? Well, we call on our resident doctor, Celeste Reese-Willis, here for this week's House Calls. And Celeste, thanks for your time as always. What if someone still tests positive for COVID after their quarantine period? How does that work?
Well, it is possible for you to test positive for COVID for several weeks once you've been positive. So as long as you have done your isolation period and you are fever-free, if you're positive, and your symptoms have improved, it's okay for you to be around other individuals after 5 days, as long as you're wearing a snug-fitting, appropriately worn mask.
All right, so how long do people need to self-isolate?
For 5 days. If you're 5 days from the date of your symptoms or 5 days from the positive test.
And then look, I know there's still, I'm asking you questions that I realize there is sometimes no answer to. Do people, have they shifted, do you think, and should they shift their expectations on what symptoms to look out for? We hear a lot about losing taste and smell. Ani is still dealing with that after having OG COVID, if you will.
Yeah, the original COVID.
The original strain.
Yep.
So if you get Omicron now, should people look for different types of symptoms maybe?
Absolutely. Some of the symptoms that we're seeing now are most closely related to common cold symptoms: runny nose, scratchy throat, fatigue, headache. You want to make sure if you're experiencing those symptoms that you get a test. The symptoms are not as severe as we've seen in the past, like that continuous cough, fever, shortness of breath. Some people are having those symptoms, but a lot of people are having those mild cold symptoms. So that's what you want to look out for. If you have any of those symptoms, we encourage you to get tested.
Going back to people who are asymptomatic, but that they have that positive test, it's 5 days for them too?
Yes, it is.
Isolation?
Yes, it is. So in that day, so day 0 is the day of your first symptom or that positive test, and then you count 5 days after. So you have to have a full day of symptoms first. So if your symptoms start at Monday at 2 p.m., that means that day 1 period of isolation for you will not be until Tuesday. Monday does not count as the first day.
When you evaluate sort of where we've been and where we are, you are in this every day. You were so involved in the vaccine efforts at Legion Field. You've been in the thick of it since the beginning, as so many medical professionals have. When you look at the map and see the spikes of several different times, and here we are again coming out of a spike, how do you see this affecting our day-to-day lives moving forward? As people look to warmer weather in summertime, is there optimism there?
Well, there's optimism if we can get our vaccination rate increased in our state. This is something that we're going to continue to have to deal with for several months until we reach a point where there are more people vaccinated than not. Part of the reason that we're dealing with the surge that we are now is that there's a subset of individuals that are non-vaccinated that COVID is more likely to spread to other individuals and then spread to those individuals that are vaccinated. So this is something that we will be dealing with in the coming months. There's concern that this could be an endemic, which would mean that this is something that becomes a regular part of a disease process that we deal with every year. And so those are things that we're learning as these weeks go on. I think the one thing to keep in mind at this point, 2 things to keep in mind, is that everyone do their part. And doing their part means being vaccinated, being fully boosted, getting tested if you're having mild symptoms so that you don't spread it to other individuals, and making sure if you are positive that you stay away from other individuals for those 5 days so that it does not continue to spread. As we know that Omicron, those symptoms typically last in most people about 5 to 6 days.
Okay.
Dr. Celeste, thanks so much for being with us. We'll talk to you again next week.
Sure.
And if you have COVID-19 related questions you want to ask Dr. Celeste, just send them to housecalls@cbs42.com or send us a message on our social media pages. We'll be right back here on CBS 42 Morning News.